Brain's security system hacked. The blood-brain barrier is a dynamic interface that separates the brain from the bloodstream. Blood-brain barrier is the fourth wall which protects the brain from potentially harmful chemicals. The great biochemical barricade in the body. The protective layer around blood vessels that shields the most precious organ against threats from the outside world. The blood-brain barrier consists of tightly joined cells that lines the blood vessels of the brain and keeps toxins and infectious agents from entering the brain. The blood-brain barrier is semi-permeable. It allows some materials to cross, but prevents others from crossing. The downside is this barrier prevents drugs from reaching their targets within the brain in adequate concentrations. The blood-brain barrier completely blocks the vast majority of drugs. This is a big handicap in the treatment of brain cancer. Safely and temporarily opening the barrier to deliver drugs is a long-sought goal for treatment of a wide variety of neurological conditions including brain tumors, Alzheimer's disease, Parkinson's disease and epilepsy. Recently a team, led by neurosurgeon Todd Main Prize and physicist Killer Vohanainen at Sunnybrook Health Sciences Center in Toronto hacked the blood-brain barrier. They succeeded in delivering chemotherapy into the brain tumor of 56-year-old Bonnie Hall. They infused the chemotherapy agent doxorubicin, along with tiny gas-filled bubbles, into the bloodstream of Bonnie Hall. Then applied focused ultrasound to areas in the tumor and surrounding brain, making the bubbles vibrate. This loosened the tight junctions of the cells comprising the blood-brain barrier and allowing high concentrations of the chemotherapy to enter targeted tissues. Crossing the neuroscience's final frontier. Opening the barrier is really of huge importance. It was probably the major limitation for innovative drug development for neurosciences. It will be a huge step in the treatment of brain diseases such as cancer, Parkinson's and Alzheimer's. The temporary opening of the blood-brain barrier appears to facilitate the brain's clearance of a key pathologic protein related to Alzheimer's and improves memory. Opening the blood-brain barrier to deliver chemotherapy to a tumor is a predicate for utilizing focused ultrasound for the delivery of other drugs, DNA-loaded nanoparticles, viral vectors, and antibodies to the brain to treat a range of neurological conditions, including brain tumors, Parkinson's, Alzheimer's and some psychiatric diseases. Focused ultrasound uses ultrasonic energy guided by magnetic resonance or ultrasound imaging to treat deeper tissues in the body without incisions or radiation. If individual beams passes through the tissue, there is no effect. When multiple intersecting beams of ultrasound are directed and concentrated on the target, at the focal point where the convergence of the multiple beams of focused ultrasound energy results in many important biological effects depending on the nature of the tissue and the ultrasound parameters. Makes the air bubbles vibrate, loosening the tight junctions of the cells comprising the blood-brain barrier and temporarily disrupt the blood-brain barrier. Effective and safe ways to open the blood-brain barrier is a major goal in neuroscience. The treatment is non-invasive and painless. The patients can go straight home. Thank you.